Greetings. My name is Irene. I'm the product manager. And on the first slide, you can see my team, Echoes of Wellness team. We're led by Lois Spy, the data analyst. Then we have Eve Carrolls, the project manager. We also have Kevin Miner, the data analyst, Jackson Owenga, UX researcher, and Shiro Aweru, the UI/UX designer. Well, we are presenting on matters of mental health awareness. So the reason why we came up with this is because majority of those who need mental health care globally lack access to quality mental health services, particularly across Africa. They experience cultural stigma, resource shortage, and also fragmented service delivery modes and lack of policies. So majorly, we are focusing on young adults ranging from 18 to 35 years old who are the most likely to face mental health conditions due in part to the challenges that come up with growing old and other added societal, political, and economic pressures. So to address this issue, we need to create more awareness, diminish pervasive stigma, implement prevention programs to decrease incidences of mental disorders, and equip people with healthy coping mechanism. So why does mental health care matter? It matters because it affects how we think, feel, and act, influencing our overall well-being, relationships, and ability to handle stress. Good mental health is essential for living a balanced, productive, and fulfilling life. So here we start with our user, who is known as Rose Awino. She's 25 years old. She resides in Nairobi, Kenya, and she's a university student in her final year. What is she going through? She's suffering depression with occasional anxiety. That is a mental health condition. As you can see where she is, it's just a photo of her. She looks isolated, sad, and in deep thoughts. So the background is Awino is a bright student. She dreams of becoming a high school teacher for the past year. She's been battling sadness, fatigue, and feelings of worthlessness, leading to declining grades in her class and social isolation. And also she experiences fear of judgment has kept her from seeking help. That is such a bad place to be as a human being. And that's why we came up with this website to create awareness, to also have campaigns to reduce mental health stigma, encourage early help seeking, and also empower people like Awino to speak up, and also build our supportive community. The next slide, as you can see here, is common mental disorder by age and sex. While both men and women experience mental health challenges, women definitely face a unique combination of hormonal, social, and psychological factors that can make them more vulnerable to certain conditions. I mean, how women are wired, they experience these different changes in their bodies every other month. So they definitely are of the high percentage who experience mental health conditions. And addressing these differences is key to developing effective gender-sensitive mental health care. The next slide you can see is mental disorder in poverty-stricken areas. I mean, it's somehow obvious. Poverty increases exposure to stress, trauma, and harmful living conditions while reducing access to support and healthcare, making mental health disorders more likely and harder to treat. This is from mentalhealth.org.uk. So according to WHO and Mental Health America, mental health encompasses an individual's emotional, psychological, and social well-being. As I had mentioned, it influences how we think, feel, and act. And good mental health is vital throughout all stages of life, from childhood through adulthood. Mental health disorders like depression, anxiety, and bipolar disorder often stem from a combination of biological, psychological, and environmental influences. However, with increased awareness, reduced stigma, timely support, and access to appropriate care and preventive measures, many mental health challenges can be effectively managed or even prevented. So what is the impact of creating mental health awareness website? One, it increases access to information, providing reliable and easily accessible resources about mental health conditions. Do you want to know the symptoms? Log into our website, you will see all the symptoms. Do you want to know the coping strategies? Definitely, you'll find it in our website. The available treatments, especially for those who may not know where to begin, all these are included in our website. Number two, it reduces stigma. By normalizing conversations around mental health, it helps to break down shame and cultural taboos, encouraging more people to seek help without fear of judgment. Number three, encourages early intervention. With educational materials and self-assessment tools, our website can help individuals recognize early signs and symptoms, definitely leading to quicker support and better outcomes. Number four, build community support. Definitely, it can offer forums, testimonials, and interactive features that connect users with similar experiences. You'll definitely know that you are not alone. There is a community that will hold you and help you. And the community also fosters empathy, understanding, and gives you hope, knowing that there is a better tomorrow. Number five, creating mental health awareness website promotes help-seeking behavior through listing of local services, hotlines, or teletherapy links. It bridges the gap between awareness and action. And last but not least, educates the public. Our website informs not only those directly affected, but also families, educators, and employers on how to support others and create a more compassionate society. Definitely, with all these impact benefits, you'll definitely want to log into our website and check for yourself. This is the wireframe, the layout from the homepage all the way to the last slide. Do you have questions? It's such an easy website to use. The colors are captivating. You would love to experience it. What are the user pain points? Users are looking to channel mental health related input and contributions into the website. They want to add more information. Also, users are requesting an anonymous section for those who prefer not to be identified. The change stroke amendment based on user feedback is that we will integrate a live system to allow users to submit suggestions directly and also implement an anonymous submission or interaction feature on the platform, ensuring user privacy and data security is maintained. Why? If we receive funding, we will build a mental health awareness website. We'll start by defining our goals and audience. We'll build our team and create educational content and local resources. The features like blogs, self-assessment tools, support directories, and forums will be included. And the site will be accessible, mobile-friendly, and regularly updated. And last but not least, we'll promote it through partnerships and social media and gather feedback to improve. Thank you so much for your time. I've been your host, Irene.